Okay, we're live. Let me see if my assistant can hear me because we had trouble with my microphone for some reason. I think I was interrupted with my microphone when I was talking about which hormones the hypothalamus controls. Can you hear me? I don't have anybody in the chat yet who can give me a thumbs up or not. Yes, okay, you can hear me. So the hypothalamus controls all your hormones, not just your sex hormones. It controls your adrenal hormones, your thyroid hormones, your gut hormones, your pituitary hormones, that's prolactin, oxytocin, growth hormone. It controls everything. And without an optimized functioning hypothalamus, you're not going to be healthy. You're not going to be as well as you could. You're going to age a lot more rapidly. Your hormonal challenges, which we all go through puberty, we all go through some sort of a pause. Menopause is most known for women, but men go through an andropause, which means their testosterone levels start falling, and that affects how they feel. It affects their bone density, it affects their muscle mass, it definitely affects their cardiovascular system, it affects their brain. People with a healthy hypothalamus age much less quickly. Okay, things go much slower when your hypothalamus is healthier, so that your metabolism stays nice and high. Your immune system is functioning normally. Your brain is functioning in a healthy way. You're able to maintain lots of different tasks, and you're able to thwart off things like dementia. For younger people, learning disabilities is key to supporting the hypothalamus. Your learning disability issues are much more blunted. That's because the hypothalamus controls dopamine particularly, but much more of the other neurotransmitters in your brain. It's the portal for the amino acids where those neurotransmitters are fed. We're finding out a lot about the hypothalamus with research, not just obesity research, but COVID research and aging research. We're finding out a lot about how the hypothalamus controls so many of your vital systems, stress and wellness. The hypothalamus controls it all. Now, I do have some questions here. So if you have yes, we are live now. Any questions, just pump them in the chat and I'll answer them as best I can. But I have some questions that we pose. We open up the questions to my email list for those that are in the Genesis Health Club. Genesis Health Club is basically for anybody who subscribes to on a subscription program for Genesis Gold. If they're getting it once a month, they're automatically in the Genesis Health Club, and they can ask me questions ahead of time so they can go back to this live and get those questions answered. So if you have any questions and you're on the chat with me now, great. Go ahead and ask those questions. So one question was that this person's energy level and brain fog has been a real issue. She's now 40 pounds overweight, eats pretty green, but nothing really works to decrease that number. Having one hot flash nearly daily. Oh, yes. She is a female because she had a hysterectomy. She'd love to get off some weight and have more energy and better brain function. She's interested in ordering Genesis Gold, and could it help her? Because the hypothalamus controls your weight set point and your metabolism, as well as your temperature control and your learning, yes, I would see that Genesis Gold would definitely help. Now, it does take some time. You need at least 90 days of taking it to really see benefits, although your energy will be better and you'll probably see that your brain fog is better within a month or so. It takes some time to really heal that hypothalamic dysfunction. Weight is going to take a little bit of time too, but you will start noticing that your appetite will start changing, what your craving is changing, and that because you have more energy, you're able to eat the same amount of calories and start to lose that weight. Definitely, you're going to want to be more active. Hopefully, you'll be sleeping more deeply. Sometimes you do get some rebound hot flashes when you first start balancing your hypothalamus. That will go away usually within a week or two. So definitely stick with it. And if you've been out of balance for years, you want to add 1 month per year you've been out of balance to that first 3 months of foundational support to really get back to optimal hypothalamic healing and functioning. So live question here. This person has neuropathy in their feet, wants to know what would work for pain. was due to a broken neck injury 5 years ago and wants to get off meds and that don't really work. So neuropathy, so due to an injury, that's a mechanical injury, probably due to a nerve impingement from the broken neck. It does take time to heal neuropathy. So I've seen my patients when they're utilizing Genesis Gold for their hypothalamus, it really helps with pain because the hypothalamus is part of the pain control center. And that will help with a lot of the pain. To rebuild those nerves, I'd also make sure that you were adding essential fatty acids to your diet and maybe even consider something like CDP choline to help to remyelinate the sheaths of the neurons on top of the hypothalamic support and really get deep level nerve healing. It will take time. It's been 5 years. So you're looking at least 8 months of Genesis Gold with the CDP choline and the extra essential fatty acids to really heal up those nerves. Joanne asked, she's been using Genesis Gold and Sacred 7 every day. Can she take her daily probiotic at the same time? Absolutely. Genesis Gold has probiotics in it. If you're taking extra probiotics, it goes very well with Genesis Gold and Sacred 7. They're both taken on an empty stomach before a meal, about 15 minutes, and that works great. You'll absorb all of it well. You shouldn't have any issues. So I just answered the neuropathy pain question. Another question that came in was, what causes T3 medication, so that's thyroid hormone, liothyronine, to make you sleepy instead of giving you energy? That is very unusual because T3 is supposed to give you energy, but some people have kind of a backwards nervous system. And that usually is caused, again, with the hypothalamic dysfunction. So the hypothalamus controls the pituitary, which then controls the thyroid. So hypothalamus, pituitary, thyroid. During that communication network, if the hypothalamus has been out of balance for a while, when you give extra T3, it sometimes sets off a message to the hypothalamus to actually lower your metabolism and kind of lower your whole nervous system. So it takes some time to balance that. I would recommend that you support your hypothalamus at the same time using Genesis Gold. The T3 medication is going to act very differently after about 6 to 8 weeks of taking Genesis Gold for hypothalamic support. You're going to have more of a boost in energy than feeling sleepy. So I have another person that asked that she's used the bare minimum of estrogen and progesterone cream, and it gave her heart palpitations. What can she do? She needs something. So low doses of hormones, when you need hormones, can actually trigger a neuroendocrine response in the heart. So sometimes, definitely you'll get heart palpitations when your serotonin levels have dropped because your estrogen levels are dropped. But sometimes when you first start taking hormones, it kind of stimulates those receptor sites and your heart wants more serotonin than you can possibly make. So you do need to support your ability to make serotonin. You can do that with Genesis Gold. You can also do that with the Sacred 7 amino acids, and that will help your body get better balance and also make your receptor sites for the hormones much more receptive to the hormones so that you're able to deal with the normal hormonal imbalances of hot flashes and weight gain and low energy and not have the palpitations. It does take some time to re-regulate those receptor sites and get your hormone levels up so they're not so imbalanced. This person says that they've been exhausted even after lots of sleep. She urinates constantly, or he. Yes, he urinates constantly, and his bioavailable testosterone is low. Will Genesis Gold make a difference, and what about GenPro? Can they take it? Okay, so 2 things. If you do have hypothalamic dysfunction, which is very, very common in men who are in the posal years, and that could be as early as 40 and into their 70s or 80s, so their testosterone levels are falling, which this person has a low testosterone level. We don't know their age. You will urinate more frequently when your testosterone levels are falling because your prostate actually enlarges somewhat, looking for that testosterone, and that puts pressure on your bladder neck and makes you feel like you have to urinate more frequently. You will feel more fatigued when your hypothalamus is out of balance. So supporting your hypothalamus with Genesis Gold is where I would start. If you're taking testosterone replacement therapy for that low T, that is when GenPro can be helpful. Taking Genesis or GenPro without taking testosterone therapy is not recommended unless you have naturally high estrogen levels as a male. Because what Progesterone it acts as a 5-alpha reductase inhibitor, which keeps your body from converting that testosterone into estrogen. So you want to stop that estrogen conversion so that you don't have too much estrogen on board. So I always recommend on my patients who are taking testosterone replacement therapy that they take a very small dose of Genpro with the testosterone replacement therapy. I'm usually looking at about 5 milligrams of Genpro to about 100 milligrams of testosterone. So it's 25 milligrams per pump, which means they would only need like a pump every 5 days or so in order to balance out the estrogen conversion that they tend to have when they're on testosterone replacement therapy. I got a question on what shouldn't you take when you're taking Genesis Gold. There really isn't much prescription-wise and supplement-wise that you can take with Genesis Gold that's going to be a problem. Okay. Now, that being said, if you are on Coumadin, which is a blood thinner, Genesis Gold is very green. And if you've already been told not to eat so many greens, adding Genesis Gold in will change your Coumadin level so much, your vitamin K, which affects Coumadin. So I still have patients who've taken Coumadin and take Genesis Gold. We just go very slowly and we watch their bleeding levels. So that's the only contraindication, but it's basically we just got to monitor you a little more closely. All the other medications, I haven't had any patients have any issues with heart meds, neurological meds, cancer meds. I mean, they're fine. We don't have any issues with that. Supplement-wise, you may need less supplementation. I do recommend when you start taking Genesis Gold that you keep on all the supplements you've been taking and let them just kind of run out. Your body, after about 6, 8, 12 weeks of taking Genesis Gold, will start talking to you and will tell you what you still need. So, for instance, all I take is Genesis Gold and Extra Sacred 7 because the stress levels have been off the charts. So I take a little Extra Sacred 7, which is in Genesis Gold. Those are the amino acids. But because I have had some recent injuries, they were equestrian injuries. I broke my ribs, thrown by a horse, hurt my knee. I'm actually taking some joint support. So essential fatty acids, some curcumin as an anti-inflammatory, and basically some biocollagen in this joint support just to help my injuries heal. During the spring, I may add some quercetin, which actually helps with spring allergies. In the area that we live, like everything blooms at the same time. So that really can be really helpful. But for the most part, it's more about, instead of taking ibuprofen, I take my joint support, that kind of thing. So it's just to help with injuries and things like that. Other than that, I'm just taking Genesis Gold. Now, recently I saw my primary care provider who's new to me and honestly could be my kid. He's like the age between my daughter and my firstborn. So he hasn't been practicing very long compared to me. Anyhow, I complained about some neck issues, some numbness. I have some issues in my neck from equestrian injuries in the past. And I told him it's probably just that, probably just need some physical therapy. But he wanted to work me up for neuropathy and ran a whole bunch of tests, which included a bunch of vitamin and mineral tests. I was pristine on all of them, and I do not take any extra vitamin or mineral supplementation. All I take is my Genesis Gold, and I eat really healthily. So you can get everything you need from your diet if you are really pristine and you fill in the blanks in terms of the hypothalamus with the Genesis Gold. And the only extra thing that I have taken is vitamin D, because there's no D, vitamin D as in David, in Genesis Gold because that's an animal-based product. I have taken extra vitamin D like during the winter, all during COVID, I was taking it to protect, help to protect myself. If I've been exposed to something, I'll add some vitamin D. And all my patients who have any issues with low vitamin D, they're vitamin D deficient, under 30, if they're under 50, I supplement them then. Also, if they have osteoporosis, we make sure they get some vitamin D. All right. So you also asked, would it be okay to get off Celebrex for your pain and you're taking low doses of estrogen and progesterone with a dose of Genesis Gold? Yes, you can take estrogen and progesterone with Genesis Gold. Celebrex, go slowly, okay? Get beyond Genesis Gold, like I said, at least a month before you start weaning. off of your pain medicine. Celebrex is a non-steroidal, but it works a little bit differently than the typical non-steroidals do. So it's not going to hurt to come off of it, but just go slowly. I have another question. This patient is currently using 100 milligrams of the Genpro. That's 4 pumps transdermally. Her nurse practitioner suggested progesterone as a pill orally. What are my thoughts? Okay. So this is a very good question. I only switched my patients over from transdermal to oral progesterone when I could no longer get what is Genpro in a prescription form. Once we started manufacturing Genpro, I switched them back and they felt great. The only time I add an oral progesterone at night, because it makes you very sleepy, okay, is if they have any buildup of lining in their endometrial cavity in their uterus. I will add some extra progesterone orally at night until we can kind of shed that lining off, but that's it. So the majority of my patients use Genpro transdermally, but there was a period of time, there was about 3 years we couldn't get it, and I had to switch quite a few of them over to the oral because we got better blood levels, although they felt sleepy all the time. They didn't get the anti-anxiety effect that they were getting with the Genpro. They couldn't take it during the day because we couldn't get the same absorption with the compounded progesterone from compounding pharmacies as we had with the Genpro formula, which was originally compounded by my pharmacist. But when he went out of business, we couldn't compound it. We started manufacturing. It just took a while. He went out of business like right before COVID, and it was hard to get a manufacturer during that period of time. So it just took a little bit of time. All right. There was another question I didn't say. Okay. So this person asked about dirty genes. Will they affect Genesis Gold to work? So what I think they're asking is if they have genetic mutations, will that affect Genesis Gold? Okay. So before we were able to do any kind of mutation test, gene testing on patients, because it's kind of new, I had Genesis Gold available, and I would see the effects of the Genesis Gold on their health and well-being, not their genes. Okay. So I'm going to give you an example. If you have a methyl tetrahydrofolate reductase mutation, meaning you cannot convert folic acid into its active form, that will affect, we see this in autism, we see this in depression, we see this in chronic fatigue syndrome. It's pretty common. So one of the markers for whether or not that is actually affecting you functionally is homocysteine. So if you get your blood test and measure the serum homocysteine level, if it's elevated, you're probably not converting your folic acid into the active form to bring that homocysteine down, which indicates inflammation in the cardiovascular system. So it's just one marker. The methyl tetrahydrofolate affects lots of different systems, but this is one marker we can look at. What I found with my patients taking Genesis Gold is that they were physically getting better. Once we were able to see that they actually had this methyl tetrahydrofolate reductase mutation, we were able to see that their homocysteine actually before Genesis Gold and after Genesis Gold was totally different. That just by taking Genesis Gold, their homocysteine levels started to drop, which meant that they were utilizing methyl tetrahydrofolate in a better way. We weren't supplementing that. We were just watching to see if the hypothalamus had any control over that metabolism. So I don't have any proof of this part of what I'm going to say, because there are millions of these SNPs that can possibly be mutated. And we only measure so many of them. We don't measure all of them. What I believe is going on is that these patients were able to tap in to another set of genetics that allowed them to utilize their folic acid more appropriately. That the type of SNPs that we're not even measuring yet. I think eventually we're going to be able to see all this, but it's going to take a long time. In the meantime, the proof was in the pudding. They were feeling better. They had more energy. Their memories were better. Their cognition was better. So I do believe that even if you have what he's calling dirty genes, which are basically mutations, by supporting your hypothalamus with this plant-based Genesis Gold, you're going to have better hypothalamic function so that your hypothalamus is able to function better and possibly even trigger other genetics that may be not expressed right now in you, to express itself in a way that actually is adaptive rather than maladaptive or disease-causing. Now, that was kind of long, but that is my theory. I do not have the genetic proof of that, only the actual whole body physical proof in how the patient's feeling and what's going on with their blood work. Okay, so I'm not a doctor. I'm a nurse practitioner. Francie Lee calls me hello doctor. I'm a nurse practitioner. She had a hysterectomy last summer. She had an endometrial uterine cancer, only kept her ovaries. What kind of hormones should she be taking? So according to how symptomatic you are, you probably could use a little bit of estradiol. Even if you have no uterus, I always give my patients Genpro with their estrogen to counterbalance the effect and enhance the estrogen receptors. It's perfectly safe. It actually allows you to use a lot less estrogen. And I always make sure they support their hypothalamus with Genesis Gold as well to help them through the transition of being completely hormonally competent and not. Okay. Endometrial cancer is caused usually by too much estrogen on board, stimulating, proliferating that endometrial lining, getting really thick, and not enough progesterone to counterbalance that. Okay. So, and it's more common in certain women. It's more common if they've had high estrogen exposure. They don't make enough progesterone, like women with PCOS don't make as much progesterone because they don't ovulate regularly. So we see more commonalities of that lining built up. You see it a lot in women who take hormone replacement therapy and they're not taking enough progesterone to counterbalance their estrogen. So you can see this. You can see the buildup on a pelvic ultrasound, but you do need to have a biopsy to determine if that lining is actually precancerous or cancerous before making any hormonal changes. Okay. Pat asks, how does this help with bacterial overgrowth, parasites, and viruses in the gastrointestinal tract? So if you have GI issues, I would start balancing your hypothalamus with sacred 7 amino acids first. I would not start with Genesis Gold. And the reason for that is all of those phytonutrients in Genesis Gold will feed those bugs. Okay. It's great for you, but it's also great for everybody else you're harboring. Okay. It's kind of like fertilizing the flowers and the weeds at the same time. When I first had Genesis Gold available, I used to run all kinds of candida tests on people. And then I found that almost all my patients with candida responded to Genesis Gold with gas and bloating. So if they responded to Genesis Gold with gas and bloating, we pulled the Genesis Gold back, we tested for candida overgrowth, and then we treated it. And then we got the Genesis Gold back on board. So because it's feeding those microbes that are also eating everything you're eating, and it's such easily absorbed nutrition, those microbes are just eating this up. Okay. So I'd start with Sacred 7 to balance your hypothalamus. And then once your gut is back into balance, which may require medication, it may require botanicals. There's lots of ways to get that gut back in balance, to get I run Genova tests on my patients, the GI profile, which gives us not just the main phylums, but all the phylums. So we can really see how balanced you are, and also whether or not you're digesting and absorbing your nutrients properly, and looks at markers for inflammation too. And what's super important, metabolic markers, which are how many short chain fatty acids and what percentages that your microbes are actually producing. Now, remember, the hypothalamus is controlling your gut microbiology. So if it's out of balance, you're more prone to getting an imbalance in your gut. Okay, they feed off one another. So you do need to get your hypothalamus in balance, but you don't want to feed those microbes until they're put back into balance, which usually means you have to get rid of the parasites, you have to get rid of some of the overgrowth, and definitely the pathogens. Will I be able to provide RXs in the near future? Maybe, maybe not. California law states that I have to have a collaborating physician. My practice actually dissolved immediately when my collaborating physician died on November 20th of last year. I can't practice as a nurse practitioner, meaning I can't write a prescription. The majority of the things I've done with my patients, though, don't require prescriptions. So I'm still doing consults with my patients, with customers, with anyone who needs anything. I write down all the recommendations that you may need not just lifestyle stuff, but what medications would work best. If you need any other diagnostic testing, again, the majority of the testing I do with my patients, they can order on their own. They're kind of esoteric type testing, and they just bring that all to me. We do it on Zoom calls now, telehealth. Been doing that for 25 years, honestly. Became, of course, really popular during the pandemic, but it works very well. And in terms of prescriptions, basically write down, make my recommendations on what their providers should be prescribing for them for that particular issue. It is an issue. The law may change. There's some lawsuits going on in California right now, which I will be probably in court, testifying on that on behalf, because it was the way the Board of Registered Nursing interpreted the California law was very, very restrictive. But things may be changing, but right now, no prescriptions in the immediate future. So this patient says that she is 9 months postpartum. She had a C-section. She's dealing with weight gain in her midsection, her hips, a little double chin, generally feeling like her hormones are out of whack still. She read that Genesis Gold is great for pregnancy, so I'm assuming it's safe while nursing. I just want to check in to see what she can and which products are recommended after birth. Genesis Gold, I definitely would start with. It'll help rev up your metabolism so you can start burning off that extra baby fat. Because you're nursing, you produce a lot of prolactin, and your body is really, really good at holding on to that fat. So, give yourself a break mentally, that you are going to lose this weight. It is going to come off. It probably is going to come off faster after you stop nursing. But in the meantime, supporting your hypothalamus will start to reset your weight set point, increase your metabolism, make you feel like your hormones are in better balance, meaning and I don't know, you may or may not started your periods back already, which is one indication the hormones can be getting back into balance or not. Sometimes I didn't start until after I stopped nursing. Some women get suppressed by breastfeeding the entire time they're breastfeeding. So Genesis Gold is what I would start with. If you find, and you should find that you're feeling better within a few weeks, healthy young women usually do really well and respond very well to Genesis Gold. But you do have to be active. You can't lose weight without exercising. So really work on doing as much movement as possible, weight resistance exercise, as well as aerobic exercise. I know you have a baby, put that baby in a stroller and take really long walks and get your endurance stuff in. Do what you can to start moving your body, because that makes a huge difference. We tend to be a little more sedentary, even though we're taking care of a child. And when you're nursing, you're sitting down to nurse, you're sitting more probably than you're used to sitting. And that being sedentary is an issue with your metabolism. So start moving around a little bit more, and that'll make a difference. Watch dance videos, aerobic videos. There's all kinds of stuff on YouTube, yoga. There's all kinds of things you can do with a baby as a weight. Okay. You can lift them on your legs. There's all kinds of things you can do with an infant. So, and to include your child with the exercise, and they're just going to have fun watching you playing around on the ground, exercising and doing yoga. So start moving, Mom. So Francie, there's no reason why you could not take Genesis Gold with Lynch Syndrome. And I'm sorry that you just found out about that a few weeks ago. That shouldn't be an issue at all for you. But get back to me on how you're feeling on it within about a month or so. You will be getting, if you're just starting it, you will be part of an email nurture sequence, which will trigger you to ask me any questions and tell me how you're doing at about the month out. So please respond to that so I know what's going on, and remind me who you are and about your Lynch syndrome. Okay, and then this last question I have here is from a 51-year-old woman who has a personal history of thyroid nodules. Back in 2011, had a biopsy. They were normal. They were not cancerous, but she had nodules, had hysterectomy in 2020 for adenomyosis. Adenomyosis basically means that the lining of the uterus has like cysts in it. It's not fibroids. And it can be a very proliferative, so it's a little thicker lining with these cysts in it. So it's very estrogen dependent and can be a little harder to control. Meanwhile, last year, she started noticing, last 3 years, she started noticing blurry vision, fatigue, and feels like she's aging at super speed. I'm sorry. She has mood swings, anxiety, hot flashes, very dry hair and skin, and insomnia. My question is, with all the above, will Genesis Gold help improve my health, or is it too risky? It's not too, with what you have going on, you can definitely take Genesis Gold. I don't know what you're doing about, since you had a hysterectomy for adenomyosis, you don't have to worry about your uterus. You may, because you have pretty severe symptoms, I would probably recommend, and it's been going on for 3 years, that you take Genesis Gold and Sacred 7 together for the first 3 months, maybe up to 6 months, okay, just to get your hypothalamus functioning optimally as possible. You'll notice your hair takes about 2 months to respond to hormonal changes. So even though you're taking it for 2 months, you're not quite there yet in terms of being balanced. It may take 3 months or so to feel balanced, and then your hair responds after that. So don't get freaked out. If you start noticing more shedding and a bunch of those short little vellus hairs, that means the hair's growing back. And shedding is the first process. It will come back. Your hair will get thicker. I've had people with chronically thin hair. They've always had thin hair. Their hair eventually gets thicker with Genesis Gold. It just takes time. Think of your hair as kind of like and your skin is the last aspects of your body that needs to heal. Your hypothalamus is going to try to heal the rest of your body first. So if your heart needs attention, your brain needs attention, your kidneys, your liver, your blood vessels, the vital organs need attention, they get it first. Your endocrine system, which are all the glands that produce your hormones, your immune system, your neurological system, they get it first. Finally, your gut, finally, your skin and your hair. So it can take a longer, and I know that's what we're looking at. We're looking at our faces, we're looking at our hair, we're noticing our nails. They just take longer to respond in someone who has been that biochemically out of balance. All the rest of the body has to be healed first for survival purposes. And then you get the shiny, thick, healthy hair and the nice, long, strong nails and the healthy skin. The aging will slow down. It will take some time to heal. So give that first 90 days, really commit to that first 90 days to give your hypothalamus the best chance to completely optimize. And then you'll find it for maintenance. A lot of my patients take less than their body weight once they're on maintenance, so Genesis can last a little bit longer. So I know it can be a little pricey in the beginning because you're like committing to 90 days at full body weight, but eventually you might be able to take less once you're healthier. Okay. Here's another question by Joanne. I'm sorry, my throat's really dry. Okay, she had some depression after using natural progesterone cream and estradiol by the naturopath. She no longer takes it. She, for about 3 months, and started Genesis Gold and Sacred 7 for about a month. Okay, so she's just, are you just asking a question about the progesterone and the estradiol? Because you've been on Genesis Gold and Sacred 7 for about a month. I would say that your depression should start to lift within about 6 to 8, maximum of 12 weeks of taking hypothalamic support with Genesis Gold and Sacred 7. It takes a little bit of time. I had more premenstrual type issues with depression and anxiety. It's always worse premenstrually. And it took about 2 months taking just the Sacred 7, because that's all we had available in the beginning, before I noticed a difference in my moods, my depression, anxiety level. It takes a little bit of time to heal up those neurotransmitters. All right. So Joanne, you have some severe sweating too. I see that in the chat. Okay. It is going to take some time. You can have a little bit of extra sweating rebound when you first start taking the Sacred 7 as your hypothalamus starts to rebalance itself. So just make sure you're taking your body weight worth of Genesis Gold. That's basically 4 grams, which is a third of that big scoop per 50 pounds of body weight, and a full scoop of Sacred 7, and you're really consistent with it. You've only been on for about a month, so it's going to take a little bit more time, but you will get there. All right. Is there any other questions? Sorry about having to start this over again, and we had a microphone problem, but looks like we fixed that. And thank you for telling me about my microphone problem, because I was just talking and talking. Okay. No more questions? All right. You have a great 2 weeks of summer. I'll be meeting with you again in the next couple of weeks. You're very welcome. And, remember, you can send me questions in. I love to see you live here, but send questions in if you can't make it, and then I'll answer those questions. And you can come back to this live once it uploads. Okay. Take care. Have a great day, a great week, and I'll see you in a couple. Okay, bye-bye.